Good afternoon, one and all present here. So I'll be presenting the topic ChatGPT as a virtual educator, evaluating its efficacy in amblyopia patient communication. The authors have no financial disclosures. So we know that artificial intelligence-based chatbots are increasingly being used to obtain information for education, research, and healthcare practice. ChatGPT is one of the latest artificial intelligence-based large language models which is hyped to create human-like responses. With the extent of its popularity and use among general public, its potential in answering health-related queries is an interesting underexplored aspect. So we know there are few studies that have already looked into the performance of ChatGPT in ophthalmology. The roles have been explored in generating discharge summaries and operative notes as well, and the performance of ChatGPT across various board examinations. So the purpose of our study was to assess responses generated from ChatGPT-4 to a frequent pediatric ophthalmic condition, amblyopia, and to assess its application in medical education. With an eye towards the future, this study aims to contribute to the ongoing consensus on integrating artificial intelligence into medical practice. So this was a cross-sectional study. The sessions were conducted on 30th of September 2023 using an online virtual platform, ChatGPT-4. So a set of 13 common amblyopia-related queries were framed. An answer to each query were generated twice from ChatGPT, and the responses were later on evaluated by 5 ophthalmologists with a minimum of 2 years experience, and these were scored from 1 to 5 based on the assessment from very poor to very good. So the median scores were computed to quantify the evaluated responses. The interrelator reliability was checked using Fleece-Kappa coefficient. Kruskal-Wallis H test was used to detect the significant differences in scoring among evaluators. And violin and box whisker plots were employed to visually represent the score distribution. This methodology aimed to provide a robust evaluation of ChatGPT's utility in addressing queries related to amblyopia. So this is the summary of evaluation scores for amblyopia-related queries. We noted that for majority of the queries, the median score was 4, except for the etiology, which had a median score of 3, and the range was from 3 to 4. And the question that if the patient could go blind if untreated also received a median score of 4. So this is the table showing distribution of different scorings by each evaluator. So majority of the questions, they received a score of 4, that is good responses were received, followed by score 3 that showed acceptable but incomplete answer to the questions, followed by score 5, and one question received a score of 1, that was a very poor response by one evaluator. So this is the table showing comparison of inter-evaluator scores, and the mean percentage of agreement among different evaluators was 74.77%. This is a violin plot of different evaluators which show that there was a general agreement among evaluators, especially around the median score area of 4. And this also indicates that major scores were favoring towards the higher end of the score with fewer scores towards the lower range. This is the individual violin plot of studies scores received from 5 evaluators. And this showed that evaluator 4 had a tendency of giving higher scores on an average, and evaluator 5 was most conservative with scoring, and evaluator 4 had the least variability among the scores given. So this is the box whisker plot of the evaluation results, which was in correlation with the above plots. So we know that in past months there has been a significant interest in examining the utility of large language models in medicine. Sakai et al. In their study found responses from ChatGPT to be 70% accurate, and the highest accuracy was in field of blepharoplasty, orbit and ocular oncology, and it was lowest in pediatric ophthalmology. Nigdal et al. Evaluated ChatGPT responses for amblyopia and myopia and found an accuracy of 81.5% and 87.5% respectively. Our results were almost similar, with showing an acceptable results of 84.6%. The strengths of our study are that we have integrated the AI-powered tools like ChatGPT into medical education. This is the first study which has extensively analyzed the responses on amblyopia, and 5 ophthalmologists were included to eliminate any bias in scoring and evaluation. The limitations include the diversity in evaluator opinions, highlight the complexity and subjective variation in interpretation, and we did not actually give any case-based scenarios, which we feel are more common. There is a more chance that parents might give prompts like case-based scenarios to understand the prognosis and treatment for their child. To conclude, ChatGPT has a potential to serve as a valuable educational and informational tool for pediatric ophthalmology patients and caregivers by demonstrating a relatively good performance. But we also identified areas like etiology and prognosis which need refinement and enhancement to enable accurate knowledge dissemination. Thus, artificial intelligence models must continue to evolve and adapt to bridge the gap between AI-generated responses and healthcare professional expertise. These are my references. Thank you.
You made two exceptions. First, you did wish us good afternoon.
Good afternoon.
Nobody, you did wish. So this is exception. Nobody else has wished since morning. So this is your crime. So we'll cut your number. This is mazak hai. But GBT is my favorite subject. So what is GBT? GPT-4 plus.
So basically, like ChatGPT, it is coming as an artificial intelligence model.
GPT-4 plus, what is that?
Sir, we have used GPT-4. 3.5 is the free version that is available.
Did you use professional version?
We use the professional 4 version, yes, sir. So 3.5, actually we initially started with 3.5, but we found the responses were really not good. So we took a paid version and did with the ChatGPT 4. We did the study because.
Okay. So again, it's not like the GPT is doing all the AI building. We need to again see and look. So they are also doing. And best part is that when they commit the mistake, AI is commit mistakes, they ask you sorry, and he say thank you for correcting me. That is the best part I like till the date. Otherwise,
Yes,
it's still in the progress, and it's good for many things like writing letter and all these things, applications. Are you married? Just asking, or not married? So it's good for doctors who have small kids and not getting a chance to doing their kids' homeworks. So that you do your professional work for yourself and your kid work with GPT. So we all must learn GPT for other works. Otherwise, in the medical field, long way to go. Because artificial is artificial and natural is natural. So it's long way. Still, we have 50 years to replace our.
Yes, sir, yes, sir. So there were prompts where we found some fallacies, like particularly related to prognosis.
Good study. Just on the.
Yeah. Dr. Veena for the next
study.
presentation.
Just one quick question. You can, when you put up your questionnaire also, no?
Ma'am, in lack of time, like I had, it's in the hidden slides.
That's a new thing you have tried.
It's in the hidden slides actually because of the
That's
time
a good
limit I
thing.
had.
It's new thing you have tried.
The results are questionnaire based, so I said.
Ma'am, I just put the highlights like it was based on the definition cause, that one thing.
Next time आपकी जगह AI present करेगा.